Hello, good afternoon, one and all. I am Dr. B.S. Ramesh, Senior General Surgeon and a consultant minimal access surgeon for Fortis Hospitals, Rajajinagar, and with an experience of more than 25 years in the field of general surgery. And today we'll be speaking about one of the most common problems of people who come to a general surgical OPD is the bottom problem. That is what we call it as generally fissure, piles, fistula. These are the one third of our practice is occupied with these problems only. So most of the time, the people will have a general public have a lot of queries about these fissures, hemorrhoids, or piles, what we call, and fistula. And many a time, it is such a problem that it will be very annoying, disturbing their day-to-day work, and it is not easily expressible to others also what's happening. Okay, social factors hinder them to come out with the expression of these problems. And in such scenarios, most of the time, what happens is these people will try and go to the people where what we call as quacks who practice says that piles and fistula clinic or something like that, and get treated in a very bad way and come out with the complications. So instead of happening going through all this ruckus, I think you can all of you can if you can understand the basic things and what exactly these things happen and how it comes and when to seek a medical attendance or a medical help, we'll just sail through this. And among this bottom problem, piles, fistula, and fissure. Today, let us know in brief about what is fissure in ANO. Fissure, fissure. All of us know that fissure means a crater. Okay, so what exactly? What is the definition of a fissure? Fissure is nothing but a linear ulcer in the anal mucosa. That is the lower part of the anal canal. There will be a small ulcer, or we can also call it as a cut in the anal mucosa, which causes the problem. So with this, what happens? What are the things? How it can present to you? So symptoms are what we call it as how does it present. One thing is painful defecation. Whenever you pass motion or a stools, you always feel that there is some discomfort, some pain, and it is lot of irritation, and that pain can remain from minutes to hours. It will be causing lot of discomfort, and you will be unable to sit or stand. That's what we call it as a pain in the ass. Somewhere, whenever we need to some address some nasty person or somebody, we call that pain in the ass. That means it is intolerable. So you can't even sit or stand and do things. So that is one of the main symptoms. And sometimes you can just have a bloating sensation, pain abdomen, and sometimes even you can have passage of stools, or you can just witness some blood stain stools, or you can witness a crimson red stain on your tissue paper while wiping. Okay, Mark. And itching and discomfort. And sometimes what happens is even when you wash or something, you can just experience or feel there is a small swelling or a tag or something like that, which is what we call it as a sentinel pile. It is nothing but an extra growth of the skin there. So with these are the symptoms generally what you place. And what are the causes for these symptoms? What we call it as causes are that hard stools. If you have a chronic constipation and if you have a hard stools, then you will have this piles problem. And straining for the stools, that you don't have a easy passage for passing motion, and you would like to strain for each time, then it can cause fissure because it comes out with a force, and hardness that can damage the anal mucosa and that can cause fissure, and this will be a recurring cycle like hard stools, ulcer, and you don't have sufficient time for it to heal, and so unless and until that hard stool factor is taken out, this will be a continuous process. And pregnancy. Pregnancy is one of the thing again where this can be precipitated. And eating habits. So if you don't eat junk foods, hard foods, all those things can cause fissures. And sodomy. Sodomy are anal liaisons or what we call homosexuals. Homosexuality, again, this can cause ulceration and can precipitate fissure. So next, you know what exactly can be causing the fissure and what are the symptoms of fissure and what are the risk factors. For anything to happen, there are certain amount of things which can cause the fissure or a risk factors. These risk factors, what are those risk factors which can precipitate the fissure? What are those? One is injury. One is injury, you can fall on your bums and there may be a small injury, and these things can precipitate fissure or injury to the anal canal. Aging process. As the age, bedridden, old, elderly, diabetes, they generally tend to have constipation and they strain for the stools and hard stools which can precipitate fissure. And obesity. That is, if you are very obese, again, hard stools, passage becomes very hard and injury to the anal mucosa and can cause fissure. And not eating habits or a healthy eating habits. That is, if you don't have a sufficient water intake, fiber diet, all those things can precipitate fissure. And lack of physical activities. Lack of physical activities can lead to obesity and again it can precipitate fissure. And any previous history of operations on that place for maybe for an abscess for anything else can cause this ulcers if the patient has been operated for such things. So how to go about it? So how do you, when you start looking at that, you have got a hard stools, you have got a painful passage of stools, and you feel that you are passing blood on and off, you have noticed passing blood on and off, definitely you have some problem. Probably it can be a fissure. How to diagnose? To diagnose that, you have to come to a surgeon like me who is practicing proctology, and you can approach us. So we can examine and we can find out there is a fissure. That is by clinical examination. So one diagnosis is by always a clinical examination. So next is you can diagnose that with a proctoscopy. What is that is a handy tool what a surgeon uses in a OPD procedure day to day, and we put that scope into the anal canal with the light or a torch light. We just see, and before that, you spread the buttocks and you see a wound there in the anal canal, which is fissure. Sometimes this can be associated with piles or hemorrhoids, so this proctoscopy can be helpful. And nowadays, as a OPD tool, again we have a video proctoscopy. Video proctosigmoidoscopy is there, so that we can pass a sigmoidoscope, which even yourself can see that. So you will be seeing that on a monitor, and we can show you that what is exactly fissure and whether it is bleeding or not can be seen on the monitor or the screen when we do it as a OPD procedure. So once this is diagnosed, next what? How to treat? So all the fissures need not get, you need not go and get operated. 90% of the time it can be treated with medications, and when it does not get subsided or again and again these symptoms with the interval of problem-free interval. You don't have any problem, and again these things are there. You are suffering again and again. Then you might need an operation. So there are two types of management or treatment. One is conservative, what we call with a lifestyle modification, diet modification, and other things. Whereas surgical management is again you have a open surgery as well as a laparoscope, laser surgery, laser ablation. Okay, so open surgery we make that tight spasm of the sphincter and make the anal canal little comfortable, relax and loose so that the motions can come out easily without injuring the anal mucosa. And that can be done by cutting a sphincter, what we call it as a lateral internal sphincterotomy. It can be done either with open surgery by using a knife, or it can also be done by a laser using a laser energy. So it is both possible. So in medical management, what are we going to advise? In the once you come to us with the problem of painful passing stools and other things, and after examination we have come to a conclusion that you have a fissure, then we are advising a medical management or some medication. Then what are those things we are going to advise? One is you start asking them to you give them a laxative or a stool softener, which helps them to make the motions or the stools soft and it comes out of the anal canal without causing damage to the anal mucosa, and it allows the fissure to heal. It is nothing, fissure is nothing but a wound in any part of the body. What do we generally do for any wound? You just leave it alone, give some rest, don't again and again, don't meditate, don't intervene at the wound site, give rest to the wound. Similarly, these laxatives will help in such a way that it will help the wound to heal. Next what? So lifestyle modification. Lifestyle modification again, that is lot of dietary management. You need to take a lot of fiber rich diet where we ask you to take a lot of green leaves, vegetables, fruits and other things. And sometimes we may have to give medications like which can relax the sphincters, that is nifedipine, and local applications of cream which can help the fissure bed to heal. And also we can ask you to take a sitz bath. Sitz bath is nothing but in a tub, take warm water, lukewarm water, add some antiseptic solutions, or even you can add some common salt also. That is what we call as a common salt or a baking salt. And then you sit in that water for about 10 minutes, thrice in a day can take care of this problem. So what are the dietary modification we do? What are the things to be eat? Because many a times when people come to us with such problem, they ask, doctor, can I eat this? Can I eat this? Or whether it can be taken or not to be consumed. He eats lot of this, that's why he's having this problem. And otherwise they notice also. They say that yesterday I had lot of spicy food, today I have got this problem. They correlate. But the things to be eaten is that you should eat lot of cereals, vegetables, and fruits, and lot of water to be taken, and fiber rich diets, lot of fibers in the diet. What are the things to be added avoided? Avoid coffee, tea, junk foods, and alcohol, and lack of physical activity. You indulge in physical activity, these things has to be done. So even after doing all these things, the if the problem doesn't settle, even after taking your lifestyle modification, diet modification, and also the treatment like sitz bath and local application of a cream or something like that, and still the problem is not relieved, then you are supposed to go for a surgical management. What is the surgical management or operative management generally we offer for such patients? One is anal dilatation. That means you just dilate the anal canal. That means you stretch the sphincter muscles so that the sphincter spasm is gone. You stretch it, make it wide, so that the passage of stools are very quite clear and comfortable without causing any damage to the anal mucosa. So that is anal dilatation. Next is you can do a fissurectomy. So that means you excise the fissure bed, make a new crater, and surgically you alter or cut the internal sphincter, which is causing the tightness for the anal canal. Once you cut that, it becomes loose and it gives a easy passage for the motions to come out. Same thing can be achieved by using a laser energy. So we call it as a laser treatment for fissure. So what we shall do is a laser sphincterotomy with a fissure bed excision or a open lateral anal sphincterotomy, internal sphincterotomy. So once the surgery is done, it's not over there. You need to give aftercare. Aftercare of the surgery is nothing but what I told earlier, that you need to sit in the sitz bath. That is, in a tub, take warm water and add antiseptic solutions like Dettol or a betadine, powidine, iodine, and sit in that water for about 10 minutes every day, morning and night, or depending at the comfort level, you can. This helps in wound healing, and also it helps in giving a soothing the patient, because that warmth gives soothes the patient and you feel comfortable, and that helps in that. And during this, because of this wound bed, then the patient will be having pain, or you will be having a pain, so that you need some laxative, so that stools will be very soft and it can be passed very easily. And diet modification, start having healthy diet, that is lot of liquids in the form of water. Avoid aerated drinks like Fanta, thumbs up, all those things, all beverages you avoid. Drink lot of fruit juices, water, tender coconut water, and cereals, pulses, vegetables, and green leaves. These are the things which can help you. And there are, what are the complications if it's not treated, and if at all if it is let it go like that only, then what are the things it can, where it can land. So this can lead to a fissure bed abscess. That means this, whatever the fissure bed is there, crater is there, that can land up in a, you can have a abscess which can cause painful, and that abscess also sometimes burst open, pus will come out, and that can turn into a fistula. Fissure, automatically fissure, going in for a fissure bed abscess and getting burst open, and then you are landing up in a fistula. Or it can be intractable pain may be there. There may be a intractable pain which is not getting relieved. That intractable pain says that it is going in for an abscess. Okay, and lot of blood loss going in or landing up in a anemia. And such things also can cause, because of this there may be a constipation, stools becoming very hard, and then ultimately there may be a fecal, that is impacted fecal, that is stools become very hard like concrete like, and it gets jammed in the anal canal. Ultimately we may have to put our finger and take it out, which will be very hard. And your patient might have a lot of difficulties in sitting, standing, or walking. So that will be the complications of this. So next, after all these things, now we know what exactly is fissure, what are the risk factors which can cause fissure, what are the causes for fissure, and what are the symptoms of fissure, and if there is a fissure symptoms, how to go about it, how to address about it by just lifestyle modification, and when the surgery is needed. All these things we have no. But for anything, and in especially in these bottom problems, there are a lot of myths, and there is myths are quite far away from the facts. What are the myths and facts? What is there? Generally, we think that these fissures are common in adults, but it is not so. These fissures can also happen in children. That is because of their eating habits of the child. Child also can have a fissure. Don't, if a child says that the child is having pain while passing stools, or if there is a blood, it can be just a fissure. try to change the eating habits of the child, and see to it that the child doesn't have a constipation, then this problem will settle down. And always these problems, that is bleeding, pain and other things, always it is correlated to the spicy food, whereas it is not so. It is a myth. Spicy food will not cause fissure, whereas other eating habits, junk eating and other things can precipitate. Okay. And not to exercise. If there is a fissure, people say that you don't exercise. Exercise is the cause. No, whereas it is myth, and the fact is that you have to. Obesity can cause a fissure, and exercise is not contraindicated in a fissure patient. Exercise is welcome. Having a daily good exercise and keeping a good dietary habit and bowel habits, that is passing stools regularly, normally, will take care of this problem. And sitting for a longer time, long duration, will not cause fissure. If you are sitting for a longer time and if there is any hurting, if there are any thing which hurts the posture and the anal canal, then it can cause a fissure. Otherwise, sitting for a longer time will never cause a fissure. And myth is again, operative treatment is not successful. But whereas operative treatment is the key to success for a failed medical management of a fissure. This is what. So ultimately, what I want to say is, we human beings are the only one who suffer from the fissure and bottom problem. Though the elephant is a huge animal, whenever we have never seen that elephant has got a fissure problem, because elephant drinks lot of water and it eats only the grass. So elephant has never got a fissure. Thank you. Anything, any questions, your doubts can I can clarify. Now, somebody is asking that is this is a genetic? No, it is not a genetic issue. If the family people dietary habits are like that, then it can run in families. Some genetics in the sense, some of the family, the people may be very obese. Obesity can precipitate. Eating habits can precipitate, but it is not genetically transferred. So piles is a general term. Somebody is asking me that I am suffering from piles. Piles is a general term which includes for, for a general person or a layman, it says that all the bottom problem, what I said, that fissure, hemorrhoids, and fistula. In as a practicing surgeon, generally piles we correlate to the hemorrhoids. So if you are suffering from piles, means what exactly is that? Are you passing blood without pain, or are you passing blood along with the pain and discomfort when you pass motion? If you are passing blood and blood along with the motion with the pain, mostly it will be fissure. Whereas if it is painless bleeding, then it can be piles or something else also has to be evaluated. As I said, that home remedies are like nothing but your diet modification and lifestyle modification. Do exercise regularly, do drink lot of water, do eat healthy food like cereals, fibers, rich in fibers, green leaves, and the fruits, vegetables. These things to be added as a staple diet for you, and drink lot of water, tender coconut water, fruit juices, and this will act as a home remedy. 90% of the time, even if you have fissure, it will settle down. Yeah, yeah. These fissures can be controlled with a diet plan. As I said, that if it is you see to it that your motions are soft, it is not hard, and your passage of motion is very easy, then this fissures will heal automatically with six bath. What is it? That's also a home remedy. You take a tub, warm water, put some salt and sit in it, or add some antiseptic solutions like Dettol, povidone iodine, and sit in that for about 10 minutes twice a day or three times a day, it will heal. Backache can be associated with fissure, but arm pain you cannot explain. Somebody says that they have got a back pain and the pain in the both arms. So back pain many a times can be associated with fissure and piles problem, but arm pain may not be related to this fissure. And generalized body pain can happen if this fissure is going in for complication and the patient or somebody is going in for anemia, then there will be generalized body ache, pain, tiredness, weakness. All these things can be there. Yes, there is some question that can fissures be cured permanently? Definitely, it can be cured permanently. As I said, that it needs surgical intervention for a chronic fissure with a sentinel pipe. And after the surgery, aftercare is very important. Aftercare is very important so that it will not recur. Aftercare includes your diet modification, lifestyle modification, and sometimes you may have to use a laxatives for a long time, quite a long time. You may have to use a stool softener or a laxative. Yeah, I'm suffering from anal fissure, and thus the rectal dilators is of benefit. Definitely, definitely, dilators are of benefit. It is of benefit, definitely. You can use the anal dilators. You can consult us only. You can. There are, nowadays there is a called as colorectal surgeons, but we are also very well experienced general and GI surgeon, and we also deal with your rectal prolapse, and rectal prolapse can be handled with minimal access surgery definitely as a laparoscopy, and we can tackle it. Before that, we need to assess what is your problem and what exactly is your problem, because there are varieties of rectal prolapse, partial, complete, and other things. We need to examine, ascertain, and then we can plan for surgery. You can consult me in Rajajinagar Fortis. And generally, this rectal problem after for complete rectal prolapse, after surgery, recovery time, if nowadays we are doing minimal access surgery, within 2 days you will be discharged from the hospital. And as I said that there will be always aftercare. So once the surgery is done, you will be given some laxatives for some couple of months, and you will be told some things, some exercises, and diets and dietary modification. So you should recover. You should be able to do everything. Will be fine by 2 to 3 weeks. No, fissures can be. Well, the question is how long it take for a fissure surgery. Is it painful? And do I need to stay in the hospital for the? Please help. I am having chronic fissure. So chronic fissure definitely it needs surgery. It is in minutes. Surgical time is in minutes, and for all practical purposes, it can be treated as a daycare procedure. But with the insurance policies and other things, you may have to stay in the hospital for 24 hours, and recovery period it will not be painful as what you are suffering. There will be some amount of pain will be there post operatively, because there will be some operative work which is done. So it will take some time to heal, but that pain will be less compared to your original fissure pain. Ultimately it may take about a week for you to completely heal and pain free. Hi, is it okay to take fiber supplement after fissure surgery? Lifelong lifelong to prevent constipation. Also, what are the chance of getting Fecal incontinence after fissure surgery. Fecal incontinence 0%. No fecal incontinence for a fissure surgery. And you need to take fiber supplements or a fiber. You don't need to fiber supplements as such. You can include that as a diet. You can include in the natural fibers, you can include in your diet like green leaves, cereals. That will help. A lot of water, liquids. How to avoid getting fissures after surgery. Also, please explain that post-care treatment to avoid fissure in future. So, how to avoid fissure after getting fissure after surgery? That is diet modification, fiber-rich diet, good amount of liquids, exercise, maintain a adequate or a normal weight for your height, and to post-operative. This is a post-operative care, and this care will help you to prevent fissure recurrence. So, so these are the questions, and I think I have answered most of the thing and met your cleared your doubts. To summarize the whole session today, we know that fissure is a quite common problem, and this is generally seen in children, pregnant ladies, and also elderly people. And commonest problem or a symptom what the patient comes to us is with a constipation, painful passage of stools, bleeding while passing stools, and discomfort to sit and stand and walk. These are the things how they what they feel. So if you have such problem, you may be suffering from a fissure. And risk factors are pregnancy, age, obesity, okay, and constipation. And risk group are children and pregnant ladies and elderly people, bedridden people. And myths myths are that it is common in adults. No, that is a myth. Only in adult, it is a myth. It is surgery is not a permanent remedy. That is a myth. And uh, spicy food will precipitate fissure. That is a myth. Okay. Fish patients with fissure are not supposed to exercise. That is a myth. And ultimately, to control your fissures, you may have to change your diet, change your lifestyle, okay, and you may have to have a aftercare for such modification, aftercare as a surgical treatment in order to prevent that problem again and again. And if you take care of such things, probably you will be free of your pain, fissure pain, and you can live comfortably and happily. Thank you. Any queries or anything, you can come and meet me in Fortis Hospital, Rajajinagar. Evening, I'll be there. I can answer all your doubts and queries, and I can give you the advice, the treatment, whatever is due for you. Thank you.